Shang and Claire.
Hello, everybody. I wish that I could see you all. It's so much easier to present that way, but we're just going to imagine your beautiful faces. I think I speak for Jalen and Claire when we say we are so delighted and honored to be here to share some of our own thoughts and information that we've collected as researchers, as people who take care of young people. We know that you come with an enormous wealth of knowledge and experiences, so we invite you to make this time you have with us valuable by sharing any advice, thoughts in the chat with the group with us. We know we will learn a lot from you, to ask us questions, because again, we hope that these next less than an hour will be really useful to you. We're going to present what we think will be really helpful, but we may miss the mark. That is okay. But there's a very good chance that we might have information that could be helpful. So please engage with us, put things in the chat, ask us questions. Thank you, Jeremy, for saying hello and joining from Indiana. So with that, I'm going to share my screen. We just have a few slides, not many, to kind of anchor some of the things that we'd like to share. But again, we will be looking in the chat. When I'm not presenting, I will take a look when Jalen and Claire are presenting. So please feel free also just to interrupt if you're able to and speak up. So we're going to talk today about self-collected sexually transmitted infection testing for adolescents and young adults. We've studied young adults throughout the country, but we've focused our talk today on Wisconsin because this is you all are our hosts. We feel like it's really important to at least let you know who we are. I'm Tammy Chang. I'm a family doctor. I study and work with adolescents throughout our communities and across the country. Really, I think that I'm a doctor and a community organizer's I'm a community organizer in a doctor's clothing, and also the mom of two teenagers. And whoa, I did not know that what I did not know till I've gone through it. And so I think what's great about that is you come with a lot of compassion and grace for the people who work with young people. So with that, I'm gonna turn it over to Jalen. Jalen, will you say hello and tell a little bit about you before we start?
Hi, everyone. My name is Jalen Parker. I'm so excited to be here. When I first started working in sexual health and such, this is what I really wanted to do. So I have my master's in social work and my master's in public health. I specifically focus on research in sexual health and infectious disease, OBGYN, that kind of thing. And I'm a research project manager at the University of Michigan. I'm also a social worker and a therapist. And that is my side hustle job. And I specifically work with marginalized folks in the Detroit area. So I'll turn it over to Claire.
Hi, everyone. Thank you again so much for having us today. My name is Claire Malott. I am a third year PhD candidate at the University of Michigan in the School of Public Health. My research interest is really in health policy, and I have a particular interest in diagnostic testing and just thinking about how individuals want to access testing, their preferences, and how we can help them meet their health needs.
Fantastic. Well, thank you very much. We're going to keep moving forward. Just review the objectives and make sure we know what this next few minutes will be about, starting with a brief background on STI rates in the U.S. and in Wisconsin. We're going to review the Wisconsin Free at-Home HIV and STI Testing Initiative, and also talk about some of the resources that will persist even after this initiative for testing at home. We will summarize our nationwide studies. That's why Jalen and Claire are here, because they are leaders of these nationwide studies on STI and HIV home testing with some really interesting insights that might be helpful. I'll talk a little bit about my clinical experiences for you to consider, and we'll answer any questions. So quickly on background, this is things that you probably know, but still, chlamydia, gonorrhea, syphilis, major problems throughout the United States, with adolescents and young adults accounting for nearly half of all the new STI infections. And within Wisconsin, you'll see on the right in this diagram, 57% of all STI cases in Wisconsin were among 15 to 24-year-olds. Historically marginalized populations are disproportionately affected by STIs for a lot of reasons, including sexual stigma, lack of access to care, which is why self-testing at home can be very helpful, and also discrimination. the rates of gonorrhea and chlamydia, so gonorrhea on the right, chlamydia on the left, are the highest among young people. And we know that working with young people can kind of be tricky. There's been an evolution of how young people are growing up since COVID with technology, social media, and now AI. And so there are definitely some very salient challenges, but we're really, really encouraged because for me, at least, as somebody who works with adolescents, I see them in a period that's really exciting. They're in a time where they're able to learn and develop in ways that they'll never be able to again. I can't help but be on my soapbox about the two major windows of opportunity among young people. The first is the first 1,000 days, which is like up until 3.5. There's major neurobiologic development. And then in the second window is in adolescence. And so, yes, these diagrams show that there are higher rates among young people, but I think that this is also a really important opportunity for people like us who care deeply for young people to help them to live their best life. So we're very excited. I wanted to just share some of this information about Wisconsin Department of Health, DHS Health Services. This initiative to expand HIV testing and STI testing. This is just December 26, 2025, where there will be these kits. I don't know if many people here have heard about them. I assume or hope that you have. It will be ending very shortly, but it's very exciting. If you look at the information that's been provided by Wisconsin, there's pretty clear and easy access to tests. This is just delivered in discrete boxes. I've not seen the boxes, but I think that can be very important. You can view the results on a secure online portal. There's support if you test positive. You don't need insurance. It's free. And it's for people who are 18 and over, for not just HIV and syphilis, but also gonorrhea, chlamydia, and trichomonas. So the information talks about the different steps. It's delivered directly to the person. You collect the samples at home. You get your results within 24 hours, more or less, and people will reach out to help you. And some of these people might be you. I'm not sure, but it's super, super exciting. And the setup, I think, has been what I've seen through public health campaigns really well done. Though the cost of something like this, I'm sure, is very high. And so I'm hoping that we can take advantage of such a cool opportunity. I, as a community person, always click on all the links whenever I share something. So here I am. I found this, all this information online. I clicked on all the links, and this is the Wisconsin Department of Health Services. This is what it looks like when you first click on it. Free at-home HIV and STI testings at the top. You can get your test for free. Again, all of this great information, private, secure, fast, no cost, no insurance. Test is still delivered to your door. Free support, results on the secure portal. All these different STIs that you can be tested for, and even some links to PrEP, which I think is so fabulous. And then, of course, I clicked on more of the links and tried to order a test myself, because you never know until you actually test it out. And I never like telling my patients or community members to do something else. I have done it myself. So free at-home STD tests. And so you'll see you can pick one of these options. The top one is just common STD test, non-specific. Typically, this is like a urine test or just a test from one site, versus the second one, which is a multi-site, which tests oral, anal, vaginal. And then you have the syphilis test and the oral quick HIV self-test, two different tests. The syphilis test requires a pinprick of your finger on a card. Oral quick is the swab of the mouth. And always reminding about the free support, which is very cool. I want to turn it over because one of the things that we realize, and I'll just go back a slide, is that something so sophisticated and wonderful, of course, may cost very much, and at some point will likely run out of funds. I wonder if there's people in the chat who have used, or I'm just curious if you say, hey, yes, I've used this, or I've told people about it. I'd be curious to know that. I heard today that it may end very soon, maybe like the end of this week, depending on how many tests are left. And so what we've done is really quickly added a resource that Jalen has put together of other testing resources online to get testing at home. And I'm going to turn it over to Jalen to kind of go through this, but also to let you all know, Claire has put this in a PDF in the chat, so you can also download it and use it later. But go ahead, Jalen, walk us through.
All right. Hi, everyone. So I made this resource, and ultimately it was to help us be able to see all of the free options. Now, some of these are limited by state, by age, all different restrictions, but those are written in the spreadsheet. So you should be able to kind of figure out which one's which, what tests are offered, all of the above. Um, so, for example, if you have people, you're working with folks in Wisconsin, I know the Violet Project would not work for you. That is limited to folks in Maryland only. But each of these has different tests and different ways of testing, and they are all options. The link that you have or the PDF that was attached in the comments, that is a list of also paid options, but the free programs are at the top. And then if you scroll, this is just a screenshot of those free options. If you keep scrolling, you'll see the paid options as well. Um, I I like to keep the info nice and accessible for everyone. So, all right. So, like we mentioned earlier, we focus a lot on research here. So, what does the research say? We used My Voice, which actually comes out of Tammy's research group. It's a national text messaging based survey for participants aged 14 to 24 years old. And survey questions are developed through this like iterative process. They're pilot tested with other young kids or I say kids, but adolescents and young adults and other folks who are experts on the subject matter. So a research question that we were looking at was what are these barriers and facilitators to STI self-collection kits for adolescents and young adults across the nation? This is a screenshot over here of the paper we published, and at the end, I can put a link to it as well in the chat. So looking at our research here, or you can go to the next slide, Tammy.
Sorry, I was trying to repost the PDF. If anybody wants to do that, or if Claire can do that, that would be great for people showing up later. But you'll also get in your email, just so you know. I'm monitoring the chat.
All right. So these are the first set of questions. We actually split them up into two separate weeks. So we have one set of questions for one week, and then the next week we had another set, which means we also had a different cohort of participants. So these were the first 6 questions that we were looking at. They were initially sent out in June of 2023, and we were asking folks, imagine it's possible to test for free. How would you want to get these tests? How would you use it? Would you use it? How would you want to turn these tests back in? Cost? Is there anything that would make you uncomfortable? Do you feel confident you could even use a test? Some folks are nervous about testing through vaginal swab. So we wanted to get information on that as well. And then the following week, we looked at questions. What would prevent you from using this service? What makes this actually a good option for you? Are you comfortable returning your sample? And how many days would you be willing to wait for a result? Sometimes free options, the length of time that it takes to get your results back can really vary. And then how much would you be willing to pay for a test if you needed to pay for it? Like we mentioned earlier, these free services aren't always available. So our results for week 1, this is just a breakdown of the demographics. And then I'll walk you through a little bit of how we looked at the data. So these were open-ended text message responses. There was a code book developed, and then we performed like a thematic analysis. And then for the quantitative side of things, the participants reported their demographic data. And then we ran descriptive statistics for demographic variables and code frequencies. So this is just a breakdown. Week 2, we have the same concept. So we have a breakdown between 14 and 19 years old and 20 and 24, and then among the gender spectrum, and different races, ethnicities, and educational attainments. So results, we collected results from 763 participants. Responses indicated that most participants would use free STI self-collection kits, and they prefer STI self-collection kits over in-person testing. A majority stated that they would prefer to receive their test by, prefer to receive their test by mail due to convenience and privacy. However, some stated that they would prefer to pick up their tests in person due to timeliness, privacy, and convenience and concerns with mailing. Some folks still live with their parents, so getting a test in the mail might not be the best option, but being able to pick it up for free at school or at a school clinic would work for them. Most participants stated that they had some sort of concern with STI self-collection kits, and mostly they were concerned about accuracy, ability to administer the test correctly, gather the specimen, and then again, privacy. So something to look out for with your younger folks. Participants who would not use an STI self-collection, that's what I just said. And then almost 90% said they would feel comfortable providing a urine sample because they had done that before. And then, folks who were nervous about doing a vaginal sample, they were nervous about collection error. So for week 2, we had 700 participants respond. The older cohort, so 20 to 24, most of them stated that nothing would prevent them from using an STI self-collected kit, and then privacy was the main concern for the younger cohort. Convenience was the primary reason for using these self-collected kits. Barriers, again, were test administration, accuracy, privacy, and cost. Of those who would not feel comfortable returning their sample by mail, most worried about the kit being damaged or lost. All subgroups agreed that 0 to 7 days was an appropriate amount of time to wait for results. Anything more than that felt like it was just a bit too much. And then any sooner than that, it's just not really a possibility when you're mailing tests in. And then most were willing to pay for an STI test kit if they needed it. And we were looking at $21 to $50 for what they would be willing to pay. And then as you notice, there are some quotes here from participants. And I can turn it over to Claire now. She's going to go over some HIV questions.
Yeah, we last year conducted a very similar survey using the My Voice texting survey about HIV testing. And our main research question was asking adolescents and young adults their perspectives on HIV testing and the factors they were considering when deciding to be tested for HIV. So we asked about their knowledge and awareness of HIV and HIV testing, what they thought was important about HIV testing, if they knew about the HIV testing recommendations from the CDC, and if they would be more likely to test for HIV if you could test at home with a mouth swab. And we had 550 respondents. We have a similar demographic data that Jalen presented for the other 2 surveys, showing the different gender identities, race and ethnicities present among the respondents. Also, this sample was much more among individuals who had graduated high school and were either accessing higher education or had received higher education degrees such as associates or bachelors. And these respondents were from all across the US. So we'll focus on findings of kind of question 5 from our survey, asking if individuals would be more likely to test for HIV if they had access to an oral swab. But I'm happy to talk more about other questions or findings if they are of interest. But we saw that 67% of individuals said that they would be more likely to test for HIV if they had access to an oral swab for a variety of reasons, showing this strong preference for using an oral swab. They talked about the ease of access, lower barriers, and the lack of needles that would be needed if you used an oral swab test. As you can see from these quotes about being it faster or less time and money, and individuals even saying, yes, I don't like needles. 15% of respondents did say that they would not be more likely to test for HIV if they had access to an oral swab, showing that there are different preferences among individuals. And those respondents had concerns about the accuracy and the extra effort that might be involved. Like, for example, as you can see in these quotes, they had concerns that a blood test would likely be more accurate and so would want to test with that instead, or that they would have to mail something in, and those kind of logistical procedures that might be different from going into a clinic and being tested directly. I will pass it off to Jalen and then I can finish up.
All right. Yeah. So what does all of this mean? Adolescents and young adults, they prioritize private, convenient, comfortable, and cost-effective at-home testing. And self-collected testing might not work for everyone, but it does for a lot, and it reduces a lot of barriers like embarrassment and privacy concerns. So STI self-collection specifically, mail-in return is favorable, but some worry about the loss and damage, and we need those results back within 7 days. Kits should be under $50. Health plan supported and free in schools. This just makes them a lot more accessible. And we need options for online, mail, and school options for return and ordering. I'll pass it back over to Claire to wrap up about HIV.
As we saw, young adults and adolescents had very similar thoughts about HIV self-testing, and then they thought it was a private option, potentially more convenient, and it reduced barriers to access. But some had concerns about the accuracy and the extra effort it would provide. And so it's important to think about these considerations when talking to adolescents and young adults and making sure they have the information that they need and are aware of their options and because they might have different preferences for how they're accessing testing. And overall, for STI and HIV testing programs, we think it's important to prioritize the ease, the affordability, the privacy, and equity, and thinking about and making sure that all individuals feel welcome into the space and are getting their health needs met. I will pass it back over to Tammy.
Thank you. I love that there's a lot of comments in the chat. Please feel free to put any questions in there as well as we kind of finish up in these last few slides. Some clinical considerations about testing. Right now, at least for the end of this week, self-testing in Wisconsin is free. But a few things we wanted to point out is that it's for 18-year-olds and older. And so for younger people, some of these other resources may be more appropriate, more accessible. Online ordering, based on what I've shown and I looked at, seems pretty simple. And they do talk about confidentiality, but it's not discussed in a way that I think everybody would feel comfortable. What exactly does secure mean? So something to consider when you talk to young people, because some of that stigma, some of that concern about confidentiality could be a barrier. And many times they talk about the packaging, but I would love to see what the packaging look like, because that's one of the things I love to show my patients or describe, saying this is exactly what it'll look like. You know, it will not say it's coming for the health department. It will not have anything related to STIs on it. The tests that are currently available include the ones listed here: HIV, syphilis, chlamydia, gonorrhea, trichomonas. For the Wisconsin initiative, you'll notice that you can only order either the chlamydia, gonorrhea, trichomonas or the HIV test one at a time. And when I try to reorder, it says that you can only order once every 6 months. So also something to keep in mind. And for the syphilis test, a finger prick is necessary. And as you saw from the studies with Claire and with Jalen, the needle in the blood situation can be pretty scary for some people, including myself, which even though I get a flu shot every year, I still get really scared. So I'm going to also just spend one slide on some things that I learned over a decade of working with youth, and some things I've run into, and I would love to hear your thoughts on this. And like I said, you all are probably experts, and I would love to learn from you. One of the things I've learned over time is young people have a very attuned BS meter. And when I'm able to convey my unconditional love to them as a doctor, the lack of judgment that I have about what's going on with them, so that they know that I'm on their side and I want to help, I can almost say anything and they'll understand, even if I say it wrong. Because I think that's one of the things that when I train others, students, residents, fellows, peers, they're really worried that they're going to say something that's offensive or that will be construed the wrong way, but I think that young people have a really good sense of when people really care about them. And I bet this group right here in this Zoom is probably in that category of caring very much for people and young people. Other thing I've learned talking on the phone, as we've transitioned a lot to telemedicine, talking on the phone can be really hard for youth. And what I realize that is that I'm kind, but I'm also very direct. There's a little bit less chit chat because they just don't socialize as much on the phone. And I think anybody with a young person in their life has a sense. Just the other day, my friend was telling me how her son had like such a hard time just even calling to order food because that's not a thing because people just order online now. But to call a restaurant or to change a reservation, it was really hard for him because they just haven't been asked to do it. They haven't had to do it. I've also noticed that sometimes when I ask a question, there's a pause when I'm talking on the phone to people, and I wonder if they heard me, or I wonder, what's going on over there. But what I realize is that they're just not processing information orally or AUR, like by hearing verbally, maybe like someone, like me who's 45. And I just give them a little bit of extra time to process what I just said or what I've just asked before jumping in to say, do you have questions? Or did you get that? Did you hear me? Did you hear me? Did you hear me? Because sometimes they may need an extra second. Along the same lines of this new generation of young people is that even though they said, yes, I would like to mail, there's actually a large group of young people who've never mailed anything. And the other day, one of the colleagues at our office had said they were mailing holiday cards and their daughter did not know that mail goes both ways. Like you could mail something out. They thought that only mail came to them and that there's that slot. They didn't know what that slot was on their mailbox or that you could put something in their mailbox that was taken away. And so these types of things I don't make assumptions about. And so when I say, okay, do you understand what needs to be done? I don't necessarily just let them say, okay, yes, I like to hear, okay, so tell me what you're going to do. First, you're going to do this. Okay, great. Okay, what about this part? What about this part? Okay, you're going to mail it. Where are you going to mail it? Do you have a place to mail it? Do you want to bring it back here and I mail it? Just to make sure that there isn't at some point a breakdown in the process. The other thing that I love to talk about, which is usually free, is for a long time in my clinical care as a family doctor, especially early on, I felt like I wasn't really making anybody feel better. I was like, I don't know how I'm a healer at all. I think I'm making people feel bad, feel nervous, feel anxious. And so one of the things, especially when I work with young people, is I try to give them kudos and encouragement. We're calling them and checking on them. And honestly, there's a lot of young people who don't get tested or don't share what's going on with them or don't pick up the phone or I always say you're doing such a great job. This is hard. You should be really proud that you're doing this. I'm so excited to talk to you. I hope that I can help you. You're taking care of others and yourself. You should feel really good about that. I can't tell you how many times that people say no one's ever said that to me. I would say, in your life or just today? And they're like, no, just in my life, that no one's ever said I've done a good job or I've done a great job. And I think that that's something that we can really fill the gap in because no matter who you are or what you're doing, there's likely something that you should be proud of because life is hard and any effort to improve your own well-being and those of others should be recognized. So that's it, enough for Tammy's thoughts. We're going to turn it over to questions and discussion. I'm going to stop sharing screen. And we'll just take a look at the chat. Thank you so much. Good job, Jalen and Claire.
Yeah, thank you, everyone. I can kind of moderate some questions because I think there's some that are specific to Wisconsin and then some that might be specific to you all as presenters. So one thing I'll just announce again for anyone who might have missed it, this Wisconsin initiative that's happening right now where a person can get a free at-home test ends this Saturday, February 28th. So that's very soon. But the good news is that in the next funding cycle, this same opportunity likely will be repeated. So funding timing is always ultimately determined a little bit by what happens with the CDC, but you all will be notified, just like you were this time, of that initiative when it is able to happen again. Some people are commenting that what they've been concerned about with these at-home self-tests is a delay in treatment. And then there was a question regarding that. how fast does a person call with treatment recommendations after the test is received? I don't know if we have that answer for Wisconsin or if you all know how that happens in Michigan. I think either one or both would be helpful.
I do not know in Wisconsin. I actually looked up zip codes to the best way. And if I had time before this talk, I would actually have done what we in research called secret shopper, where I've gone through the entire process. But I've clicked on every single link on that website. So Jeremy Roseberry, just so you know, in the facts, they do say that if you've tested, they'll say something like, if I have HIV or syphilis, is this for me, right? And it does say, no, this is not for you because you will have antibodies. The test is for antibodies. So that you do need to see a provider. So that is there. And I think that it would be wonderful if somebody who's had a patient who used this test before answer about the timeline. I'll tell you, my sense looking at the website and this initiative is that it's pretty well organized, but until somebody goes through it, I don't really know. And I think that's a great question because when you talk to people, and as you saw in what Jalen and Claire said, it is a concern, especially for young people. Well, I'd be happy to do a home test, but if it's going to take twice as long or more than 2 weeks, it's not acceptable, right? Like even young people will not tolerate that. So that's a really good question. I wonder if anybody in the group knows the answer.
Yeah, I know people are not able to come off of mute in webinar format. I apologize for that. But if anyone has any experience or you or a client or patient of yours has used it, please feel free to type out and share with us. Um, Lorianne and Delaney, if you happen to know what happens after a person sends their tests in, if they do have a positive result, we'd love to know. Otherwise, I can see what I can do to find out and send out the answer via email, if we're not sure.
Adele, I also see a question about the confirming testing I'm sorry, confirming treatment once they've been tested positive. And I think that's very similar to the question about how long does it take. You know, it
Mhm.
says if from a provider perspective, if treatment is required, are they going to see a provider to get treatment? If not, how are we going to make sure they are taking the medications appropriately? Is this explained in the kit or the results? So my sense, based on the name brands of the test, this is a testing initiative, and that calling in is the next step where all of this would be done. And my sense is that Wisconsin has this service where people who've gone to a chlamydia get a call and some of this is reviewed. I know in the state of Michigan, we have pretty wonderful laws for partner therapy, expedited partner therapy. And so I don't think that the kits will talk about treatment and how they're supposed to be treated.
Okay. Yeah, and I can see that our DHS team who's on is doing a little bit of research to see if we can answer some of these questions. Um,
Yeah, so what Delaney has there for the oral quick, that's like a COVID test at home, right? So that's the oral swab for HIV and you just do it. That's what your MAs would do in my clinic. They would just you would swab and you just stick it in the thing with a liquid and it would run like a pregnancy test. That on the website it says you must report that to get a confirmatory HIV test, right? That is just for you at home, step one, to prompt you to get further testing. The rest are mailed in, and so my assumption is that your health department would be notified of those positive tests, and then it would trigger the cascade of treatment communication.
yeah, and that's correct. Tammy from Ashland County, way up north, just commented that the positive results that do come in are put into WEDS, which is our like monitoring system for STIs. So then the public health department in that jurisdiction would reach out to the person to make sure that treatment and notification of partners is done.
I see an anonymous attendee says our clients have consistently reported that they don't get treatment for about 30 days after sending their test in. I wonder when they are notified of their positive test. So they don't get treatment for 30 days, but when are they notified of their positive test? Because there might be some flex there if they're notified of a positive test that they could actually go into a place or have that result and show it to somebody to get tested more quick or to get treatment more quickly. There's always a workaround, and I wish that healthcare was about really great processes, but usually me and my clinic are just leveraging all the workarounds.
Yeah, for sure. Thank you all for these are really, really good questions. I'm glad this is creating a dialogue. Even the ones we can't answer right now, you're prompting us to see what we can do to get you these answers. So thank you everyone for asking. I see too, if anyone's willing to share some grant information on how they get testing kits for their public health offices or vending machines, that would be appreciated. For sure. If people email me or put it in the chat, I can share those widely as well.
Yes, and you all seem like people who are very well connected, and I wonder if that gap between the positive test and the treatment, at the same time as getting the tests, that a process could be disseminated about ways that you could get rapid treatment, not just rapid testing. Because I bet there's a way.
Okay. Oh, and Kristen from Outagamie, hi Kristen, comments that their county does purchase the test. I know they use them in vending, they have them in vending machines, but they have to purchase them with their own funds.
So the question about if a patient with pharyngeal chlamydia were to use this test, one of the test options is the multi-site, one of which is oral pharyngeal. And so they would be able to test oral pharyngeal and then be treated. It says, would an NP swab need to be completed? Yes. And so in my practice, um, if someone says to me they are only having oral sex, I will absolutely test their oropharyngeal cavity. If they're saying they're having only vaginal sex, I typically wouldn't test. But if they're having vaginal sex and oral sex, then if their vaginal test is if they only want to do a vaginal test, I'll tell them it's possible we might miss, but if they're having oral and vaginal sex, it's going to be in one of the places. So testing in one of those places is better than not at all.
Mhm. I'm wondering, like maybe when you were looking at this originally, Tammy, like clicking on the links, when it says like multi-site testing, if I'm a teenager, I might not know what that means. Was it explained anywhere, like why I might want to choose multi-site versus simple test?
It doesn't explain why, but it does say where. So it says
Okay.
anal or oral, throat, and
Okay.
urine
Okay.
or vaginal. So vaginal, not urine, vaginal. So I think that that's a great point, Adele, because I never make assumptions with young people, and it is probably an area where more explicit explanation can be. Because sometimes people come in who are knowledgeable and say, I need to be tested in my throat. And some people have no idea that things like even HPV can be spread through oral sex and cause head and neck cancer 40 years or 30 years later.
Hmm.
There's a question in the chat about if schools are having difficulty buying and distributing kits. Candy said most districts rarely allow any sexual health education, let alone STI test kits. I'll let someone from Wisconsin or in schools answer that.
I can speak to a little bit of that, and then someone like Lorianne or Delaney, feel free to jump in if you want. It definitely depends on the district. So Milwaukee, for example, and Madison-Dane County does have things like that. Um, I would venture to say that likely many other districts would not, because it's a policy that comes down from the individual um, school boards and the county government basically. So you are really, really right. Um, what public health departments can do is public health departments have their own ability to have vending machines. These vending machines that can have STI, self-test kits, home kits can be put somewhere that young people can access. But ideally, we'd love to have these things in the school. You're absolutely right. It's a huge barrier, and I think that it's something that, we on our free time, not in our .gov emails or addresses or whatever, could definitely speak to the importance for making that really accessible to our young people. Because you're right. If schools don't have it, that would be really, really helpful for schools.
I'll just add my experience working in school based health centers is that we have a lot of limitations about talking about sex or birth control, but there's actually way few barriers to STI testing. For example, we've actually done a program where we test the entire high school for chlamydia and gonorrhea, where everybody in the entire school got a bag with a cup. Everybody was required to go in the bathroom. You don't need to pee on it at all. Everybody was given a number. And so if that's possible, I want you all to feel empowered to ask and say, can we put these kits? Because mine are I believe in Wisconsin even, I'm almost certain that STI testing and treatment is a minor consented healthcare that can be provided. You don't need a parent, right? So I think that there could be culturally some barriers some places, but I don't think legally or even from a public health policy standpoint, there should be very many barriers. And a lot of times we make assumptions about what's possible and not. But if we just ask, right, for the benefit of young people, I don't think that it's always going to be what we assume. Like it will be a no. I think that a lot of times we will be surprised that people might be really receptive.
Yeah, if there's not a policy explicitly against it, that would be
No,
ideal.
there shouldn't be, right?
Yeah,
There isn't a policy that says about STI self-testing kits.
yeah, that's great. Yeah, that's ideal. If we could get some, let's see. This is probably a question for from Jen Lee, if you see in the Q&A. Um, Studies or data about potential missed opportunities.
Oh, I think that's it's a really wonderful question.
Yeah.
I don't necessarily think that this is my own opinion, right? I don't necessarily think that we're trying to um, keep people from coming to the clinic who want to or need to. I think that because in America we have a patchwork public health and healthcare system, that this is just one patch in that patchwork. Um, I love talking to young people, and there's tons and tons of conversations we can have about other things and resources beyond sex, even. But the at home testing kits, the thing that I really, really love about it is that I think that we have trained young people in America to think that they have to go to a doctor or a healthcare provider or a nurse to be healthy or to have agency in their sexual health. And it's just not true. I think that once we can help empower young people to have agency by having these types of resources, that they will be more likely to engage in their health and be better at working with healthcare providers. So that has been my experience. That is my goal. I hate when people think that they need to come to me for a test or a treatment for them to be healthier, to live their best life. It's not true. It's just not true. And so but I do see what you're saying, Jen, is like, yes, of course, but sometimes people can't come in. And I love that there's other options for them.
Yeah, just to follow up on that, I know there is some research being done. I'm not sure on a national level, but I know that there was research done with the Violet Project where they had a website. I'm going to put it in the chat here. Um, and if you click on it, you can see that they have information about getting tested. This is again where youth in Baltimore can order, or in the state of Maryland can order tests, but they can also order period products, condoms, all sorts of things. So this project, for example, was trying to address a lot of those different problems just with information that is given in a very youth-friendly way. And then I know that they do also have some research projects, or I'm sorry, some like white papers on it. If you look up Samia, um, Samia Sao, she is like the researcher or the person who invented Violet with Dr. Janelle Coleman. And a lot of her projects, if you look up her name, you can read her white papers about it.
That's helpful. Thank you.
I hear a lot of people navigating the gray area of schools and clinics and young people. And I think, everybody in every community is going to start at a place. That's something that I've come to just realize. And my goal is never to say, well, everybody's going to get the same thing, because it's just not going to happen, because culturally we're very different. But I always try to say, well, how can we get people just one step closer to empowering their young people in a way that's appropriate for that community? Because it doesn't help if this program that we're installing into a community is not welcome or makes people uncomfortable, right? That doubly puts pressure on young people to do something that is already hard, but then is perceived as wrong or bad. It's much better when you can create a program that the community can get behind, which allows young people to feel that positive agency and saying, I'm doing something that I can be proud of, right? So I know it uses a different part of our brain to say, like, well, this is the one right way. Sometimes there is not one right way, and it may not be the best way, but it's the way that will be accepted. And I am more than happy to do that. And we'll talk again next quarter.
Yeah, thank you. If you'll all look in the Q&A, I know that Lorianne, the head of the STI unit, is answering some of the questions and concerns. So thank you all for putting those in. This is sparking a really good discussion, which I think is really important. And I'm glad we're all kind of able to see each other's questions and answers. Because right, when we're trying something new, there's hiccups. We'll get it right. But ultimately, as Tammy was saying, in rural places, for example, or in places where someone might not have transportation, or maybe there's a barrier with getting out of the home, concern about parents. Sometimes an at-home self kit could really be the best option for someone who may not be able to make it into a clinic. Let's see here. I'm just kind of making sure we've answered what we can.
I'm going to put my email in the chat in case people think of other things later on. I know that happens to me. Like as soon as I hang up, I have more questions. So I'm just going to put my email in the chat in case people have questions later, and I will do my best to either answer or to connect people. The world is so relational. I hope that you will see us as a member of your team to help out however we can, if possible. I hope that as we get to know you all, that we can learn from you as well. Are there certain populations we can see are using these kits more often? Yeah, that would be such interesting data. And I believe Lorianne has the connections to know who is tracking these things and to do a little bit of assessment and evaluation of its efficacy, right? I think would be so interesting for you all to know of all the tests that were sent out. If it's going to end on Saturday, however many that was, how many were positive? How many were followed up? How long did it take to follow up? How do we know if people were treated? And whether the data is good or bad, we can learn from it because, like Lorianne says, it's possible you all might get this again with more money next year, and having that data could really equip you to say, look at the efficacy or look at the areas we could really improve if we just got a chance to do it again.
Absolutely. Let's see. I'm going to leave Q&A open for a couple of minutes. If there's any more questions or comments people have, we'll definitely keep it going because there's been some really good discussion here.
Yes, and Adele, I really love when we're on virtual, if there's no more questions now, we can always end early.
Yep, that's true. Yeah. We can absolutely give people, 5 minutes back in their day too, which I know is a gift that we don't get very often. Let me see. Yeah, people have some administrative codes in the chat. That's fine. Um, yeah, I'll just leave the Q&A open for a bit, but people can exit as they want. Oh, we have another.
I do. I do have a tip or thought about getting school buy-in. The ways that I've had the most success is not coming in as an outsider, even though I work in the school-based health centers. I'm not part of the school. But when a champion within the school that already has credibility, sometimes it's a health teacher, sometimes it's a gym teacher, sometimes it's a coach that already knows the principal or already knows the school board, they champion the idea and you kind of support that, I found that to be much more impactful and much more effective. And sometimes it means that you have to share out a little bit of information about the community, right? Like in your community, as the researcher and the doctor in the community, I share sometimes like, wow, I'm seeing a lot of this. Here are rates. Here are how the rates are changing. Here are the things that I'm learning. Many times I focus on stories. Although I'm a researcher, I'm very data driven. I really like to use the narrative and the lived experiences of young people to get my point across. And that can really excite a local champion, somebody who can really push through all of the administrative steps. Because in a school, in a public school, I think rightly there are many steps before any type of thing is done, but much more effective than if I were to come as somebody who's not a teacher.
Same. In my teaching sex ed school days, I've only gotten in schools because of a math teacher, a counselor, a vice principal, one really powerful secretary who is the most well-known person in the school. So, yeah, make those connections.
Or
Oh, someone
sometimes,
says in the chat.
yeah, or
Oh,
even sometimes it's a student group that usually is the most effective, is when there's like a group of students who are really passionate about it and they bring to the table this opportunity. People really listen to the students.
Ideal. Oh yeah, and we have it in the chat. Try the school social worker as well. Definitely. Thank you all so much. I'm going to put some of these resources in the thank you email that will go out later today. Thank you so much, Claire, Jalen, Tammy, for being here, for answering questions, for having this dialogue with us. Thank you for Lorian and Delaney for answering questions in the chat, and for all of the attendees for posing questions and answering one another's questions. This is really nice to have this little community and be able to discuss. Thank you all so, so much. We'll see you soon. And remember, the testing initiative in Wisconsin ends on Saturday, but we'll expect it again and, order what you can through Saturday.
Thank you all. Look forward to staying in touch.
Thank